China deploys COVID-style measures as a Chikungunya outbreak grips Guangdong. Foshan, Guangdong Province. Early August 2025. China is confronting a fast-moving Chikungunya virus outbreak in Guangdong Province, with over 7,000 confirmed cases concentrated in Foshan, and additional sporadic infections in neighboring cities such as Guangzhou, Shenzhen, Dongguan, and Zhongshan. Public health emergency reignites old strategies. Facing the most significant Chikungunya crisis since the virus first surfaced in China nearly 2 decades ago, authorities have revived public health tactics reminiscent of the COVID-19 era. These include mass testing, patient isolation under mosquito nets, mandatory 7-day hospital stays, and hospital conversion for quarantine use. Nearly 95% of reported cases are mild, with most patients recovering within 7 days. Environmental and climatic triggers. China's ongoing monsoon season, marked by heavy persistent rainfall, has flooded urban areas and surged mosquito breeding habitats, accelerating the spread of the virus. Guangdong's rivers are at critical levels, with widespread flooding further complicating public health challenges. Innovative vector control strategies. In addition to conventional anti-mosquito measures like insecticide spraying and removal of standing water, officials have experimented with novel biological interventions. These include introducing larvae-eating fish, deploying elephant mosquitoes, a species that preys on virus-carrying Aedes mosquitoes, and employing drones to detect hidden breeding sites. Households face fines or even utility shutdowns if they fail to eliminate stagnant water. A disease with global implications. Chikungunya is an arthropod-borne viral infection transmitted by Aedes aegypti and Aedes albopictus mosquitoes. Typical symptoms emerge between 2 and 14 days post-bite, and include high fever, intense joint pain, muscle ache, headache, and rash. While the disease is rarely fatal, mortality is about 1 in 1,000, joint pain may persist for months or even years. Globally, the virus has triggered more than 240,000 confirmed infections and at least 90 deaths in 2025, affecting regions in Africa, Asia, South America, and island territories like La Réunion and Mauritius. Travel advisory and vaccine update. The U.S. Centers for Disease Control and Prevention (CDC) has issued a Level 2 travel advisory for Guangdong, urging heightened precautions for travelers visiting Foshan and surrounding areas. Travelers are encouraged to use insect repellent, wear long-sleeved clothing, and stay in air-conditioned or screened accommodations. Pregnant individuals, the elderly, and those with chronic illness are highlighted as particularly vulnerable. Though 2 Chikungunya vaccines have been approved in the US and EU, 1 US vaccine has been paused for use in people over 60 amid reports of rare neurological and cardiac side effects under regulatory review. Why the outbreak matters. Although chikungunya does not spread between humans, imported cases, especially via international travel, concede local transmission in regions with populations of Aedes mosquitoes. China's climatic conditions and dense urban environments provide fertile ground for outbreaks, especially during flood-prone monsoon seasons. This episode underscores the urgency of robust vector control strategies, timely travel advisories, and public health readiness. With no antiviral treatment available, communities must rely on symptomatic care, mosquito avoidance, and public education to stem transmission. Recommended precautions for residents and travelers. Use EPA-approved insect repellents. DEET Icaridin. Wear long sleeves and pants. Eliminate standing water around homes. Sleep under mosquito nets when indoors. Seek medical attention if symptoms like high fever and debilitating joint pain arise. This outbreak in southern China serves as a crucial reminder that mosquito-borne viruses remain a potent threat, even in regions that have never experienced widespread transmission before.